What should your blood pressure be as you get older? I'm going to cut to the chase and tell you what I'm officially supposed to tell you. And then as we go along in the video, we'll discuss, is this set in stone? And the answer is no. But the blood pressure should be 119/79 or below. That's the goal currently as we speak right now in today's world. That's what everyone's blood pressure should be, regardless of age. So if you're 20 years old, 30, 40, 50, 60, 70, 80, 90, that's the blood pressure. And that's the standard answer according to the American Heart Association, National Institutes of Health, all those government agencies. And here's the deal. Not everybody agrees with this, interestingly enough. There are many doctors that have issue with these recommendations and don't feel as though they are really accurate. The problem is that the pharmaceutical companies tend to dictate the research because that's who has the money to do research. It's just the way it goes. So the answer is, if you're going to ask, what should my blood pressure be? I'm 85 years old. The answer is it should be 119/79 or below. But now let's talk about the exceptions and why maybe this really isn't a good idea. There was a TV show called 60 Minutes, and they were interviewing some people, doctors, that were doing research on blood pressure. And this was really fascinating. And what they found was that at a certain age, when you start to become like 85, 90 years old, the higher the blood pressure is, the less risk there is of dementia. And they were theorizing that when you lower the blood pressure so low with medications and you're just artificially lowering it, that the pressure of the arteries doesn't get the blood up to the brain, and this may play a role in some people with dementia. And what they were talking about was the fact that most research on blood pressure is researching it on people that are of the age where heart attacks and strokes are prevalent and really shouldn't be occurring at that age. And we're talking 40 to 50, maybe 60 years old people. And when the research is done on those people, there's really not a lot of research on people that are really old, 80, 85, 90 years old. And one of the challenges is not only with the dementia, but when you start trying to artificially lower a person's blood pressure to some number that you have in mind of what is supposed to be the successful blood pressure, a lot of people end up with this low blood pressure, feeling faint, feeling dizzy. They could fall. And if you get a 90-year-old and cause them to fall if they break their hip, then very likely within 1 year, they're going to be passed away from complications and the inability to move and things of that nature. One of the end results of the research on blood pressure for older individuals, it came to the conclusion that we just don't know. So the doctors that you see when you get to be a certain age, they don't know either. Now, if they're working for a company that's mandating that your blood pressure be 119/79 or below, then they're going to prescribe you medications. But many doctors disagree with this for the very reason of the dementia, the falling, and it does not necessarily improve a person's life, because ultimately longevity, living a long time, isn't the goal. Living well is the goal. And if you're giving people medications that are giving them tremendous side effects and there's really no benefit, then what are you giving the medications for? It's a good question. Now, I'm going to read to you something because I took notes on this. If you want to live to be 90, here's what most of the people found of what it takes to be 90. A little bit of alcohol, a little bit of caffeine, a little bit of exercise, and a little bit of romance, and very good genetics. This is the unfortunate thing, is our longevity may be predicted more by our genetics than anything else. Did your father live to be 90? Did your mother live to be 90? Did your grandparents live to be 90? And keep in mind, your grandparents probably were in a totally different century. My guess is, if you're watching this, that your grandparents, who had no knowledge whatsoever of nutrition or exercise or anything, they didn't have the internet. They weren't born last century, they were born 2 centuries ago. That's the point, is that if your family history is showing that you have longevity, chances are, almost no matter what you do, you might live a long time. Now, of course, you can shorten your life by maybe smoking, excessive drinking, excessive stress. You could eat a lot of processed foods, one of those just eat fast food 3 times a day type of thing. But even some people, why do some people do all those things and live forever almost, and other people are eating the perfect diet and die at a young age of a heart attack or stroke? It's because of genetics. But I thought that was interesting. They said, a little bit of alcohol, a little bit of caffeine, a little bit of exercise, a little bit of romance, because that's what makes life fun, and good genetics. Now, one of the things they looked at was what type of diet did these people who were living a long time follow? And there wasn't one specific diet. It had some commonalities, but you can't really name the diet, because everybody wants to have their club or their cult basically as being right. But for the most part, most of these people that were living at this age were just eating natural foods, not a whole lot of processed foods. They weren't obsessive about their diet, but interestingly, they did not eat or overeat a lot. Many of them were not overweight. What you find is people that are overweight tend not to live as long, and that's unfortunate. But if you can maintain good weight and eat moderately and not excessively, not a lot of processed foods. So when you go on the internet and you hear all about all these longevity experts, and they're all claiming that it's the diet that makes a difference, it may be simply just being happy, being thin, and having a little bit of romance could make all the difference in the world. I thought that was fascinating. But getting back to the blood pressure, the interesting thing about blood pressure is the argument is that as you age, your arteries will naturally get stiff. That is normal. And the reason why that should happen is because that increases the pressure enough so that when your heart beats, it has something to push against, some resistance to get blood to the tissues of your body, particularly your brain. That's what they were studying, of course, because of dementia and falls and things like that. But nonetheless, if you want water coming out of a fire hose to go far, you need a lot of pressure in the fire hose. This idea that our blood pressure should be the same no matter what your age is makes as much sense as your skin should be the same at 20 as it is at 90, or your hair. You see the gray hairs there? Imagine if they said that gray hair disease is not normal and you should not get gray hair, and you should have the same thickness of hair, the same color of hair as you did when you were 20. How about eyesight? I'm wearing glasses. Shouldn't I have the same eyesight? Now, of course, we look at these things and we think to ourselves, well, that's ridiculous. No one should have the same skin tone and same skin shape and elasticity when they're older as they do when they're young. But there's entire industries that are trying to sell us products to try to make our skin look younger. And that is you're just gonna spin your wheels. You're not gonna make it. If you get to be the ripe old age of 90, you're going to have different skin. You're gonna have different eyesight. You're gonna have a different hair color. You're gonna have different muscle mass. This is considered normal. Why is it that our arteries are supposed to be the same? I'll tell you why. Because they did research and said, that's the way it's supposed to be. Now be quiet, take your medicine, and let's make your blood pressure 119/79 or below. And that is the challenge. That's why many people, when they take blood pressure medications, they very often have side effects, because it's likely that when they go to the doctor, they have maybe white coat syndrome, or maybe the skill level of the nurse wasn't as great as it should be, and they got diagnosed with high blood pressure when there were some mistakes that were made in checking the blood pressure. By the way, that's common. And at the end of the video, I'm going to put a box right here of 11 mistakes in checking your own blood pressure, but you'd be surprised how many healthcare professionals make these mistakes too. So keep that in mind. I'll have that at the end of the video. A lot of people feel as though it should be allowed to occur, that your blood pressure should be allowed to get higher. Not, we're not talking 200 over 120, but the systolic needs to be higher than 119. The diastolic should be allowed to be a little higher than 79. And very often when you find that people are allowed to have their normal blood pressure, as long as it's not excessive, they tend to be a lot healthier. Now, I'm sure you have opinions of this. Let me know in the comments section. And right now, if you're really concerned about blood pressure, make sure you're taking your blood pressure correctly. So watch this video right here in this box and make sure you're not making mistakes, but most importantly, make sure your doctors are not making mistakes when they actually diagnose you with hypertension or high blood pressure.